Surviving cancer is more than just getting through that experience. It can also affect our sense of identity and our sexuality. Hi, my name is Ted Meissner, and today we're going to be reviewing research around how breast cancer survivors can be helped by mindfulness in dealing with sexual dysfunction. Our guest today is Lori Brotto. Lori, welcome to the podcast. I'm so glad you could be here today.
Hi, Ted. Really happy to be here as well.
So we're going to go in depth on some recent research that you have done on mindfulness and some other programming on human sexuality and a
hmm
specific area of that. But before we get into all of that, I'm wondering if you could say just a little bit about your background and what it is you do.
Well, yeah, I would love to. Thank you for the opportunity. So, I am a professor in the Department of Obstetrics and Gynecology at the University of British Columbia, which is in Vancouver, Canada. I'm a registered psychologist, and my clinical services focus largely on helping individuals to promote their sexual health and overcome sexual concerns. And then I also am the executive director of the Women's Health Research Institute. In that role, I have the pleasure of really supporting a lot of various kinds of women's health research across the province of BC.
Awesome. And that is quite a lot that you have your hands in this area. And in particular, one of the things that caught my eye about this research is how it helps those who are struggling a bit because of
Mhm.
their encounter with breast cancer. So I'm wondering if you could say a little bit about what prompted this particular study getting done.
hmm Yeah, I would love to. So I have been interested in, really fascinated by the role of mindfulness as a tool to help individuals overcome sexual difficulties since I was a fellow, really, in back in 2002. And at the time was doing research with cancer survivors, primarily gynecologic cancer survivors who talked a lot about difficulties that they had in their sexual health during their recovery after their treatments for gynecologic cancer. And they talked a lot about feeling disconnected from their bodies, really mourning their former sexual self, trying to grapple with what their new identity was. And at the same time, I had been introduced to mindfulness. One of my supervisors handed me a copy of Full Catastrophe Living by John Kabat-Zinn, this tome of a book, as part of my clinical training, and a series of events. And many months into the residency, I began taking what I was learning in my mindfulness training and the mindfulness groups that I was going to, and bringing them to these cancer survivors and really inviting them to, as I was learning and immersing myself in mindfulness, inviting them to consider whether this might be a tool to help them reconnect with their new sexual selves. And the response from this small group of survivors was, "Wow, I never knew that paying attention could put me back in touch with sexual sensations again." And so that was really the first very small pilot study, proof of concept that I'd been involved with. That was, like I said, back in 2002. So fast forward now a few decades, and my team has taken the elements of a mindfulness-based intervention, adapted it to populations of primarily women with sexual concerns. And the most recent study that you mentioned, Ted, was an adaptation to breast cancer survivors, where we know that there are wonderful advances in the treatment of breast cancer, which means that more and more individuals with a diagnosis are surviving their breast cancer. They're living many, many years in the post-treatment stage of their lives. But at the same time, the majority of them will encounter sexual difficulties as a result of those treatments. And so we took the mindfulness intervention that, again, we had adapted to other populations, first worked with a group of breast cancer survivors to understand how could this be adapted to that particular group, and then we tested it. So we led a randomized controlled trial, which means that survivors with breast cancer with sexual concerns were randomly assigned to either 8 weeks of mindfulness, which we delivered online, or 8 weeks of an education-only group. And that was the basis of the project.
Wonderful. And correct me if I'm wrong, the STEP program, that is that education aspect of it. Could you say a little bit more about that?
Yeah, so STEP, which is a supportive expressive psychoeducation group, was really about giving survivors educational information to help correct myths that they might have about sexual concern, about sexual response and sexual difficulties, but also provide them with some foundational information, such as what are the different kinds of sexual difficulties? What is the prevalence of these concerns? What do we understand about the sexual response cycle? So there was no therapy involved in that group, and it was really to control for some of the educational information that was also embedded within the mindfulness group. So it wasn't a inert control group because, of course, there was educational information, which, as it turns out, is actually quite therapeutic for people as well.
Yeah. One of the things you mentioned a few minutes ago was refreshing people's understanding to their new sexual self.
Mm-hmm.
What I liked about that, it wasn't a complete ending as a change, that there is a
Mm-hmm.
new self. I'm curious if any of that showed up in the results of the
Mm-hmm.
study or the work you're doing in general. Maybe you could say a little bit about what you've found.
Yeah. Yeah, and there's certainly concepts of new normal in the survivorship literature and experience, and it is about, you're not going to be the same as you were before, and in particular with regards to sexual response, especially in breast cancer, where there will be some survivors who are using a maintenance hormonal therapy that essentially keeps their estrogen levels very, very low, which is a way of protecting against breast cancer recurrence. However, at the same time, by keeping estrogen levels extremely low, it makes them very vulnerable to sexual pain, vaginal dryness. And given that when something hurts, we have less desire for it, understandably, they're also going to have reduced desire for sexual activity and capacity for arousal. So the concept of the new normal is very much about exploring, being curious about what is my sexual response currently through practice. Is there an ability to experience sexual response in a new way that was maybe unfamiliar to me in the past? And mindfulness just fits so well here because it really is about being curious, being open to the present moment, and being very compassionate to oneself. And the compassion part is so important because there may be a feeling of, oh, why did this happen to me? Or why didn't my doctors catch this earlier? Or why isn't treatment better so that I don't have these sexual side effects, which can really compound suffering that may already be there. So mindfulness is such a beautiful tool to be used in this context. And yeah, so that's what we did.
So, with this exploration of how mindfulness and education programs can help with that shift to a new sexual self, wondering if there were any things that were standing out for you as things you perhaps not expecting or validating in the research. What were some of your responses to what was found in this research and in general your work in this area?
Yeah. Yeah, I guess the one of the key findings is that mindfulness, and I'll say this sort of as I look across the many studies that we've done over the past 25 years or so, is mindfulness is very effective for improving sexual desire, reducing sexual distress, and maybe not surprising to your audience, cultivating quality of life, improving mood, reducing general suffering. And I think it's such an important finding in the kind of sexual health sphere, because there does tend to be this desire for, is there a medication to fix the sexual problem? And there isn't. I mean, well, to be honest, there are a few FDA and Health Canada approved medications that have lots of side effects that can be rather expensive, and for whom benefits stop when the person stops using the medication, which is the case for a lot of other treatments as well. And so I think that's the second really important finding that we've seen in our research. We follow people over time. So once they complete the 8-session or 8-module program, we follow them for 6 or 12 or sometimes even beyond that to ask the question, what happens? What happens in the long term? Are they still practicing? Do their symptoms revert back? And what we've found very consistently, study after study, is there's a retention of the gains that people experienced. And in fact, in some cases, a continued improvement in desire and response and a continued reduction in distress. And we think in part it's because when we ask about continued practice, the vast majority of people are continuing to practice. Right. So it's not that they do 8 weeks of intensive mindfulness and they get better and then suddenly they're a different person and they go back to their general way of being. They're motivated to keep practicing. They're also seeing the ripple effects on other facets of their life, their communication, their relationships. And so they continue to do the practice. So I think that's been a really, really important observation when we look back at the trend across these studies.
And such an important aspect that you mentioned, that this impacts not just one area of a person's life, that it touches many different aspects of how we live in every day and what's encountered. You also have a couple of books exploring these topics. I wonder if you might mention those, and for people who are tuned in, I will have links to those books as well. But Lori, if you could maybe say a little bit about each of them.
Yeah, so Better Sex Through Mindfulness, which was published in 2018 by Greystone Publishing, is really a synthesis of the science. So what does it look like to apply mindfulness to sexual health concerns, primarily in women, although not exclusively? And what does the science say about that? So it really is written in an accessible way so that any reader can understand what mindfulness is, what it looks like to apply this to sexual health concerns, and an understanding of what the some of the benefits in the studies has been. And then after publishing that study, I received quite a volume of emails and phone calls and letters from people saying, "Oh my goodness, this is terrific. Sign me up. Sign me up for the group." And after discussions with the publisher and with others, we decided to take the same treatment manual that we had been delivering and evaluating in our research context and rewrite it in a self-help book. So it's written in a way for the individual, primarily with low desire or sexual concerns, to work through module by module. And so it's sort of like having their, mindfulness-based sex therapist in their own hands as they're reading the pages of the book.
One final question for you. What might you say to someone who is encountering some form of sexual dysfunction, whether it's coming from breast cancer and how that impacts their views of themselves or something else? What might you say to provide a little bit of encouragement to them?
Yeah. So I think first I would acknowledge that sexual health is a component of quality of life, and it's recognized by the World Health Organization as being a really important part, a fundamental aspect of life. And so um, to not be afraid or ashamed or feel burdened to ask for help. That's, I think, the first fundamental thing that it deserves reminding for all of us. And the second thing I would say is that we as humans have an incredible capacity to overcome sexual difficulties regardless of whether they're due to cancer or spinal cord injury or head injury or a medication or a significant relationship conflict or a depression or an anxiety, that much like other facets of our emotional response, we have this innate ability and a resilience, and mindfulness can be an incredible tool to foster that resilience over time. And it doesn't matter your age, it doesn't matter your sexual orientation or relationship status, that we have tools to help individuals really cultivate better sex.
Wonderful. Thank you for that. And for those who are watching or listening, depending on the platform you're finding this on, there are links to more information, including those books, and more information about our guest today, Lori Brotto. Lori, thank you so much for being here today and for all of the work that you're doing.
Thank you so much, Ted. It's been a real pleasure to have this conversation.
Thank you so much for joining today. Please do remember to tap that subscribe button, especially if you found some value out of this, and share it with someone who may be impacted by the effects of surviving cancer. Remember, every moment you have a choice. Make it the best you can, and I'll see you again soon on Mindfulness Voyage.